Hi guys, so it's a sad state of affairs when a public health minister doesn't understand the problems facing her department. If she isn't capable, she should resign. But resignations are the last things on the minds of Boris Johnson's government. Here's Maggie Throup, who you may remember from some weeks ago. She's the Parliamentary Undersecretary of State for Vaccines and Public Health. She was on Sky News answering questions about how NHS trusts are dealing with the current staff shortages. Sorry, silly me, she didn't actually answer the question because she doesn't know how many are. And she started blabbering on about how great the government is and how great Oxford University is. Let's hear what she had to say.
Is it, sorry to cut across you, but is it wrong for you to say? I mean, we wouldn't want you to mislead, but it strikes me that perhaps you just don't know.
To be honest, I haven't had an update this morning. As we know, the Lincolnshire Hospital Trust declared one yesterday, and others have declared them in the past. And I think, as I've said, it can be very short-lived, and it can be longer as well. But
it can be short-lived and it can be longer as well. Now, see, the problem with all of this is that the government don't treat this as an information exercise. You know, the government minister is there to provide information to the public. No, the Tories do it a completely different way. This is about defending the government. It's not actually about providing information. That's what the scientists are there for, it seems, to provide information to the public. The politicians instead, government ministers, seem to be just rolled out to defend Boris Johnson's actions, to defend Boris Johnson's government's actions. Not actually about providing information to the public, because she should actually have this information. That is her job. If she doesn't have the information, why not? And if it's incompetence, then she should resign.
For different reasons. Sometimes it's staff shortages, sometimes it's bed capacity. It's a complete mixture, and it's quite right.
You're the Minister for Vaccines and Public Health. You're the Minister for Vaccines and Public Health. The government has put you up today to talk to us about COVID, to talk about the pressure on the NHS and to reflect on the last 12 months of the AstraZeneca vaccine. But surely in that case, you should know how many NHS trusts are in critical measures at the moment.
The journalist is laughing here because it's ridiculous. Why are you being presented by the government to answer questions if you're not able to provide us with the answers to these questions? Obviously, as I said, she's not there to do that. She's there to protect the government.
And indeed, how many people in the UK are self-isolating? They seem to be really key bits of data that the public want to know. They want to know how many people are self-isolating. They want to know if their local hospital trust is in a critical condition or not. Does the government have a handle on this?
It definitely does, and obviously there's meetings on a on a daily basis with the key people within NHS England, and there'll be an update later on that situation. But as I've said, the best thing to do to help to protect the NHS.
And now we get to the gaslighting, or maybe not gaslighting, but offloading of responsibility onto the public. So she was asked about, what are you doing? What is the government doing to deal with the extra stress and strain on the NHS? What are you doing to deal with the staffing shortage? And her response is, yeah, we have meetings every day. Now I want to offload the government's responsibility onto the public.
And to make sure that other major infrastructure can continue, is for people to come forward for their vaccines. As you say, it's actually just a year today since the Brian Pinker had that first Oxford AstraZeneca vaccine out of clinical trials, and that's a real good milestone. And it's an amazing achievement for British research and innovation that since then...
I've talked about this before. Oxford University, in the development of this vaccine, also received money from the European Union, but Brexiteers will ignore that. The British government will ignore that.
Over 50 million of those doses of the Oxford AstraZeneca vaccine have been put into arms in the UK, and 2.5 billion doses across the world have been administered of that particular vaccine. And it's testament to the work that's gone on within the UK.
The question was about stress on the NHS. The question was about staff shortages. Did anyone actually hear an answer to those questions? Anyone hear her talk about how the government is dealing with the staff shortages or the stress on the NHS? No. The answer was the public need to go out and get their jab. That's it. I really don't understand why the media actually entertain this, because she's not providing information to the public. She's there just to defend Boris Johnson and the government's actions. It's no longer an information exercise. It's about covering Boris Johnson's behind. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.